Yeah. Good evening, Dr. Anuja. Can you unmute yourself? I think I do not see the option here. Uh, yeah.
Am I
Good evening,
audible?
everybody. Yes, Dr. Anuja. We can hear you. We'll just wait for another 2 minutes to start this webinar. I'm just waiting for attendees to join in. Okay, so good evening, everybody. We are going to start the webinar now. And good evening, everyone, and welcome to the Gyaan Vardhini Webinar number 14. I'm Anand from Clinsav team, and I thank each one of you to join us today as we embark on yet another enlightening journey of wisdom and knowledge enhancement. So before we begin, I would like to share a brief overview of the amazing Clinsav app that we have developed over the last 5+ years. Clinsav means clinic savvy, and it is the only mobile-based clinic management app in India that allows you to manage your clinical practice in a full or 100% offline mode. It has a very simple design. Clinsav helps doctors easily manage patients' appointments, case papers, full prescriptions, bills, fees, issue of pre-filled letters, manage finances, and doing follow-ups with patients for any outstanding dues. Clinsav also sends automated appointment reminders 1 day in advance to your patients through SMS. And it also gives you the ability to simply swipe and send custom WhatsApp messages to your patients. So now we shall start with our today's webinar. Today's webinar topic is psoriasis, line of Ayurveda treatment with case study. Our distinguished speaker for today is Dr. Anuja Salwatkar. Dr. Anuja is an Ayurveda Charya, having 4+ years of experience, and she has completed her bachelor's from Vidarbha Ayurveda Medical College, Amravati. Dr. Anuja has expertise in treating heart disease, diabetes, joint disorders, metabolic diseases, thyroid, obesity, skin diseases, gynecological problems, and infertility. Dr. Anuja has been associated and worked with Ayurveda Charya, Dr. Milind Sajanwar. She has 1 year of experience as a compliance medical officer at Madhavbagh, Vartak Nagar, Thane, and she has been awarded as diabetes and lifestyle expert by Madhavbagh Institute. Dr. Anuja, we are honored to have you with us today to conduct this webinar. Let us all welcome Dr. Anuja Salwatkar for today's session. Dear ma'am, you can start with your session now.
Thank you, sir, for the warm welcome. Myself, Dr. Anuja Salwatkar More, currently practicing at Thane at Jadayu Ayurvedic. First of all, I would like to thank Dr. Milind Sajanwar, sir, who is my mentor, guru, who has taught me through the Gurukul the line of treatment for psoriasis and all the other diseases as well. ब्रह्मानंद परम सुखदम केवलम ज्ञानमूर्ति द्वंद्वातीतम गगन सदृशम तत्वमस्य आदिलक्ष्यम एकम नित्यम विमलचलम सर्वदि साक्षिभूतम भावातीतम त्रिगुणरहितम सद्गुरुम तम नमामि. गुरुर ब्रह्मा गुरुर विष्णु गुरुर देवो महेश्वरा गुरुर साक्षात परब्रह्म तस्मै श्री गुरुवे नमः. So starting this lecture, psoriasis. First, I would like to start with one of the important definitions which WHO has provided. I got this from the site of WHO itself. Categorized as non-communicable disease, chronic, painful, disfiguring, and disabling disease, for which there is no cure. Just note the point, for which there is no cure. मेरे पास एक पेशेंट ऐसे ही एक रिलेटिव ने मुझे बोला था, बेटा ऐसे ऐसे मेरे बेटे को तकलीफ है, तो इसका कुछ इलाज है क्या? तो मैंने बोला अंकल भेज दीजिए, एक बार मैं देख लेती हूँ. So what that patient has told me, he was 24-year-old male. He went to the topmost dermatologist of the town of my place, and उन्होंने कहा कि वो डॉक्टर ने मुझे ऐसे बोला है कि आप अमेरिका तक चले जाओगे, मगर ये डिसीज के लिए आपको कहीं पे भी कंप्लीट क्योर नहीं है. पेशेंट इतना दुखी हो गया, he felt like doing suicide, कि ये कभी ठीक ही नहीं होने वाला. So that is the word which WHO has mentioned, for which there is no cure. But yes, Ayurveda can give good cure, and that we will be seeing through the next cases and throughout the presentations. Other thing I want to communicate, non-communicable disease. मैं एक 12th में स्टडी के लिए नागपुर में थी, तो मेरे एक फ्रेंड को, who was my roommate, got psoriasis. I was not knowing at that time that was psoriasis. जब भी वो सुबह उठती थी, पूरा बेड में डैंड्रफ पड़ा होता था एंड पूरे पैचेस होते थे स्किन पे. मुझे लगा 12th आने एग्जाम है, मुझे हो जाएगा तो तकलीफ हो जाएगी. एंड मैंने भी उससे थोड़ा डिस्टेंस मेंटेन करना चालू कर दिया. वो शी यूज्ड टू स्क्रैच ऑल द डे. बट अभी मुझे पता चला है, अगर मैंने उस वक्त उसको थोड़ा सपोर्ट किया होता, सो शी माइट बी आउट ऑफ दैट वेरी सून. तो ये नॉन कम्युनिकेबल डिसीज है, यही मैं इससे बताना चाहती थी. तो नेवर, पेशेंट को ऐसे कई बार फील होता है कि लोग हमसे दूर जा रहे हैं ड्यू टू दिस स्किन डिसीज, बट दिस इज नॉन कम्युनिकेबल डिसीज. मेनली इसमें फिजिकल, इमोशनल और सोशल बर्डन, ये तीनों चीज एक साथ आ जाती है. मेरे पास एक पेशेंट था, मैडम मैं शॉर्ट्स नहीं पहन सकता, मैं शर्ट, हाफ स्लीव शर्ट नहीं पहन सकता. इसके कारण मुझे स्ट्रेस आता है, बिकॉज वेन एवर आई गो आउट, पीपल विल आस्क व्हाट हैज हैपेंड. So as you can see in the picture, this is scalp psoriasis typical pattern, as you can see, and this is nails. Yes, you can get such type of patients at your clinic also. You might be getting, but whatever I'll be telling today is my experience. The case which was the game changer for me while I was learning at Sri Vishwasadhana Ayurvedic Clinic, Varda, under my mentor Dr. Milind Sajanwar sir. What that shloka means now that I got it here completely. Mahavastariti Mahasthanam Matsya Shakalum Iti Matsyatvaka Sadrusham. Just like the scales of fish, patient was feeling to do suicide. His brother got to know about sir and he brought to the Vardha's clinic. So that this case was the game changer for me, and from there I decided, yes, I can cure patients if I decide. This was the case, as you can see. Complete full body, and this has erupted within a day. Yesterday night there was nothing. Second day it was completely on the body. Next thing you can see, the afterwards result is after 4 weeks. 4 weeks of Panchakarma and medical treatment, Ayurvedic medical treatment. This was the scene. And now this person was the renowned lawyer of my own town. स्ट्रेस फैक्टर वाज कोरोना आ गया था, तो कोरोना में मेरा बिजनेस चलेगा कि नहीं, हाउ आई विल गेट द क्लाइंट्स, दिस वाज द स्ट्रेस फैक्टर, एंड दिस रिजल्टेड इनटू सच काइंड ऑफ सोरियासिस. अभी ये सोरियासिस के लिए पेशेंट 3 रिनोड डर्मेटोलॉजिस्ट के पास जाके आए थे जो नागपुर में थे. उनके पास जाके भी उनको 1.5 महीने में कुछ रिलीफ नहीं मिला. देन ही अप्रोच सर, एंड दिस वाज द रिजल्ट within within 4 weeks. So this was the life changing case. और ये केस ने सर को क्या दिया, that what I saw, it gave name, fame, earth, everything. This This patient was the reason for opening the new branch of Hinganghat, where I was the clinic head, and all the patients coming in the first initial 6 months were from this patient. तो इतना कुछ एक अच्छा पेशेंट को ठीक करने के बाद मिल सकता है, ये मैंने ये कैसे जाना था. So let us go to the cases first, and then I'll be talking about what is given in the Shastram. मेरे पास एक 24-year male.
Excuse me.
Yes, sir.
Yeah, Dr. Anuja, just a quick request from the audience. If you could speak in English, because few of the attendees,
Hindi?
understand English. They have requested for English. Yeah.
Okay.
Yeah. Thank you,
So
Doctor.
one of the patient came to me, 24-year-old male patient. He was diagnosed with plaque psoriasis by dermatologist, came to my OPD. Complaints were itching, large scaly lesions, mainly on the skull, lower lip, chest, hand, cheeks, and few lesions on the back. Just go with the history. Mainly, you just listen with the history, because hetu are very important factors which are already described in our text. Then we'll be going back to our text. Since 5 years, patient had complained. पेशेंट को मेंटल स्ट्रेस किस चीज से आता था. पेशेंट को मेंटल स्ट्रेस क्यों प्रॉब्लम है इसलिए आता था. लेजन्स इंक्रीज हो रहे थे डिस्पाइट ऑफ एलोपैथिक इंटरवेंशंस. मिथोट्रिक्सेट, सैलिसिलिक एसिड, हाइड्रोकॉर्टिसोन. पेशेंट ने 2 साल कंटिन्यू किया. जब लेते थे हल्का कम होता था, वापस बढ़ता था. अगेन इट यूज्ड टू इंक्रीज. So personal history. He had excessive exercise for 2 hours in AC gym from 8 p.m. to 10 p.m. 8 p.m. to 10 p.m. at night. You can imagine. 2 years back, patient started working as counselor. He was himself counselor, but he had stress. Can you imagine? But his clients were from foreign, so he used to stay awake all the night, sleep by 4 p.m. and get up by 11 o'clock. Surgical history, no, but addiction. He as he had stress, as he had to wake up all night, he used to have 5 to 6 cigars and alcohol occasionally. But cigars were daily. Sleep inadequate due to itching also while he was sleeping. Just go with the weight also. How the weight decreased. 83.5 kg was his weight. He was daily non-veg eater. Because gym person has told, itna protein, this much protein should go inside your body in the morning, in the afternoon, in the evening. He used to have like 6 to 7 eggs daily. Uh, he was Kapha Pitta dominant person. He was South Indian person. He had mental stress due to skin problem and also due to his work. Tongue was whitish, yellowish coating. Stool. Always ask for the stool history. Is it sticky? It had bad odor. 1 to 2 times he used to go. Urine frequency 4 to 5 times, and sweat was there. Mild bad odor was to the sweat. So 31st Jan, you can see the picture, how the patches were there. This is for 31st Jan. And within 15 days of treatment, you can see the patches. On 21st Feb, I will be telling you with the treatment also. Just look how the follow-up went. 21st Feb, 25th Feb, we did woman. 27th Feb, post woman, this was the picture. 8th March, a little bit mild irritation was there, not even itching, and 1 to 2 patches came out. So I had leech therapy, and after that, on 11th March, I called and I did Rakta Mokshana with previous day Gritman. 15th March, I planned for the Virection. See, till now from 83, 79 kg was achieved. On evening of Virection day, it was 77.5 kg. I gave Ichha Bediras for the Virection. 21st March, from 83, weight came till 77 kg. Takradhara was done. Takradhara for stress management. Takradhara was done for stress management. Takra, which was filled, which was medicated Brahmi, Amalki, Jatamansi, and Musta Amalki lemon was put on the forehead before the Chakradhara. After that, you can see the miraculous result. Day 1 and day 40 result on the chest patches. This was the scalp thing. Here a little bit patch was there. You can't see, but it was there. I had put leech, and this was after 30 days. The complete result went like this. And now the patient has the clear and complete scalp with non-itching. I know Kushtan is repeated Shodhan to prevent the recurrence. So I told him to take psoriasis yoga daily for like 6 months, monthly once Sadhya Virechan with earlier day Matikta Grutpan, and monthly once Rakta Mokshan. And every year for next consecutive 3 years, Vamana. So patient came in Vasant Rutu only. So I did Vaman was ideal in that phase. Even अगर वो मेरे if he had not come in Vasant Rutu, then also I would have done Vaman because Kapha Pitta dominant Samprapti was there. Case number 2. You can see the scalp. Reddish demarcation is there. On the forearm, scalp, it was itchy. This was second follow-up pictures. First follow-up I could not correct because he had hair and I told to trim it completely. So next follow-up I had these photos. Before that it was completely with dandruff, scales, scaly it was. Note patient was 40 years male, weight 69.2 and date was 14/7 means July month. Itchy, red, scaly scalp. Few reddish, scaly and itchy patches on abdomen, forearm. Weight gain in last 2 years was the major complaint of the patient. His abdomen was full of gases, bloated. Mild stress was due to finances. Vada pav. In 7 days, patient used to eat 3 vada pavs. You can see, very yummy. Hope you all like this vada pav. But have it once in a month, not 3 days in a week. Daily potato, he was UP side, so they used to put daily potato in the sabzi. No addiction was there. History of kidney stone and COVID. But he was not admitted for COVID. Breakfast, tea and chapati. So tea had milk, chapati had salt. And he used to have 10 a.m., 2 p.m. roti bhaji, 4 p.m. tea, 7 p.m. dosa, vada pav, samosa, farsan with tea. Everyday scenario. And dinner at 10:30 p.m. Dal, rice, roti bhaji, everything by 10:30. You can imagine it never get digested. It just get stored as in your body. A bad combination in early in the morning, tongue coated, patient was constipated, stayed in toilet for like 30 minutes, but never felt like satisfied. No fixed time for stool, sticky, bad odor. Physical activity 1.5 kilometer. Medications, Lagu Manjista Adhikada with honey, Kaishor Gugur 2BD, psoriasis formula. What is psoriasis formula? I'll be explaining you. Trifla Gugur, Gandharvari ki Churna for Rechan, Dantamanjan, since his tongue was coated, Pradhaman Nasya of Sunti. Whenever patient comes to my clinic, initially I do Chirovilachan with Pradhaman Nasya and Nidrajana Nasya for stress management, which contains Ketar and Khadishakar rock salt. So 14/7 patient came, weight was 69. On 8/8 patient's weight was 66.2. Post 2 Virechana, which were done Sadhya Virechana. Sadhya means like patient used to have ghee for 2 days and then Virechan thing, followed by Samsarjan Kram. Post Virechana, see, you can see there is no reddish demarcation. Notice all over the scalp. 14-7, this was reddish demarcation was there. 8-8, no demarcation is present, no itching was present. 69.2, 66.2. Wait, 1 kg loss after 1 week medications and diet. What diet should be given, that I'll be explaining you. What that weight loss causing diet is there, that I'll be explaining you further. Virechan 3 times. First was Bruhat and then 2 times Laghu Virechan. First went for Virechan, then Vamana, because his body was heavy. He had bloating. First we did deepen Pachan, and then when body lost around 4 kg, then I planned for the Vaman thing. So Snehan Pan was with Aravada the group. As I was the reddish demarcation was there. Patient was eating all the Pittakar ahar. So I gave Arabhada the group. PSO, PSS and PSP. What is this? Sora Siddha oil of SKM, Sora Siddha cream of SKM and Sora Siddha soap of SKM for daily use throughout the treatment. Very good result. Tried and tested. You can use 100% result of this basic 3 combination for application. Arogya Vardhini 3BD, because Mal was also not clear. Deepan Pachan was also expected. And Medohar Karya also I was expecting. So after 15 days of day 1, I added 3BD. Woman was done 65.6 kg. Weight came. Total glass 60. Total weight 84 and Kafantik should be. One thing I noted, after almost 250 Vamana till date, that the Kafantik Shuddhi is mainly seen in psoriatic patients. If patient has previous history of acidity and all, then only Pittantik Vaman happens. But mostly it is Kafantik Shuddhi. So 10-8, in August month, I applied the leech. My leaching came, therefore I applied. 11-9, patient was feeling low energy levels. So I administered Tikta Kshirabasti with Mahatikta Ghritam. 20 gram of Mahatikta Ghritam was advised 14 days. Patient was uh, not financially stable, so I told him to take it at home only. I gave the medicines. He took it at home. Patient was feeling very energetic post Tikta Kshirabasti. See, Tikta Kshirabasti can be given when Athatrayanam Vyadinam Panchakarmani Bheshajam Bhattaya Shira Sarpi Tiktoko Hitani cha. So means energy giving also, blood purification also, and अस्थि मज्जावर कार्य है इसका. So PSO, PSC, PSS was continued with psoriasis formula for next 6 months with Rakta Mokshan. I told him to continue for next 6 months and Rakta Mokshan once and Sadhya Virejan. Now also patient is in follow-up, comes to me for Rakta Mokshan. See, 14-7 patches on the abdomen were like this. On 17-8 patches got clear completely. Weight loss 4 kgs. 14-7 patches on the back were this. Now on 17-8 patches got clear. So these are the results I saw in my patients with this type of treatment. Case number 3. Very interesting case. You will all love it. 57-year-old female. She was complaining that family was jealous of her and her progress. Husband always used to suppress her. Don't wear this saree, don't go out like this. So these were her thoughts. She had no sleep for like last 2 years, not a single day sleep. She was मतलब उसने 2 साल without sleep निकाला है. She used to overthink. Both the palms cracking, itching, dry flakes came out on itching since 8 months. Full body dryness, severe itching, bleed sometimes due to severe scratching and itching. Acidity was there, burning sensation in chest and bloating. Unable to wash utensil was her concern. no sleep from last 2 years, full night goes in thinking. History, one abortion, one to full-term normal delivery. See, one of the major factor was menopause at the age of 31 years itself. Allopathy medications for 3 months, no results. Ayurvedic medications for last 4 months, not my treatment, other doctor's treatment, but no panchakarma. Diet history, from 7 days, patient used to eat green leafy vegetables 4 days. Poha for breakfast. Earlier, used before going to that Ayurvedic doctor, patient used to eat stale food for last 30 years. Stale food. You can imagine. Stale food is Rakta Dushtikar. Daily black tea for 3 times. And how much black tea? Complete coffee mug. Because I was not having milk tea, therefore I am having that black tea full coffee mug. Dinner by 10, 4 months back before going for that Ayurvedic treatment from other doctor. You can see when she approached me, her legs were like this. Daily itchy. Medications prescribed. लवमंजेश्वर जे काढावेत महातिक्तदूतम आरोग्यवर्धिनी कंडुग्नघन रक्तपाचक निद्राजनन नस्य 2 drops each. PSO, Sorasiddha oil, Sorasiddha cream, Sorasiddha soap, Nidra map, 2 HS. Advice Tatkara for next 8 days because I thought stress was the major factor for her and no salt diet for next 7 days. Not a pinch of salt she had in the first 7 days. And 8 days of Takradara, she was not financially good. So I told her to do it YMT college. She did it for next 8 days, no salt diet, and with this medications, Nidra Mat tablet of Maharshi Ayurveda works very good for sleeping issues. Result after 20 days of treatment. Chakradhara was done in first patch and other. Then next Virecham was planned. See, blackish, itching, somewhere it is bleeding a little bit. Then after Chakradhara, this was the scene. And after Virecham, very soft hands. So these results came within 20 days of treatment. Just with Chakradhara and Virecham. Follow up after 20 days. Mild burning was there still. Acidity reduced by 50%. So added Avipatikar Churna. Stress reduced by 50%. Sleep. See, important major change came here only. The patient had no sleep for last 2 years. Now patient slept from first day of treatment 10 to 6. The effect was not only of medicines but also of Takradhana. So where to induce what, which Panchakarma is very important. Rakta Mokshan done, plant Virecham for next week, Turasiddha oil for Bahya Snehan, and Mahatikta Group from Abhyankar Snehan. Patient financially not stable, so she did it at home only. I used to take follow-up daily, and this were the miraculous change for from 20 days of treatment. This was my Khargar visit patient, and I saw great recovery. So I mentioned this case in this follow-up after 20 days. Acidity reduced 100%, sleep improved 100%, thoughts which were throughout the day, throughout the night, reduced 75%. Patient feels positive towards life. Every time when she approached me, I did her counseling apart from taking her for 1.5 hour. Planned woman for next month as it considering Vasant Rutu, I told her, and then Tiktashir Basti, which I'll be doing in the next month. So this was my recent patient, and we'll be telling her to do the Virecham and Rakta Mokshan for next 6 months. Case 4, very interesting case. I hope you are not getting bored, enjoying. 48-year male patient, sitting job, stressful, continuous travel, had meeting, kabhi Kolkata, Chennai, Goa, Bangalore, he used to travel, had seafood mostly. He was South Indian, and he had fermented food. And when the non-veg days were there, like Wednesday, Friday, and Sunday, he used to have seafood mostly or meat. Dry, flaky skin, reddish, itchy on both the legs, back, scalp, both the hands. Patient unable to sleep due to itching. Since last 20 years, he was suffering from last 20 years. The Nidan here is very interesting. You will love that. Scaling was there, continuous stress due to skin was there. He was into the corporate sector. So any of the patch was like he used to become conscious about that. Gases was there, bloating was there, hair fall was there, dandruff he told. Patient unable to wear t-shirts and shorts was the major complaint. तो फिर पूछ लेता है what has happened. See, you can see the patches, how they are. See, this is on back, this is on front. Patient did radioactive material industry job, which was in submarines in the initial years. The 6-month duty was on sheep only. So sheep, continuous duty on sheep, it becomes stressful for them to manage. It was his young years to do the career. He had seafood daily in the boat, in the ship, alcohol daily for stress management. So to pay for 8 years. This was his life for complete 8 years when he was on duty on ship. Now he is having alcohol 1 in 7 days. Major history goes here again. Otitis media he had 28 years ago. He was on antibiotics and painkiller for complete 2 years, as it was not healing. Typhoid 25 years back was admitted and heavy dose of antibiotics for 2 months. So this became the trigger factor of that otitis media, antibiotics and painkillers for the psoriasis. This is when his patches erupted on the scalp, very small patches. Patient is South Indian, dinner, lunch, everything South Indian, fermented food. He was on homeopathy medications for last 15 years. Initially, he had allopathy medications. Diet history: morning patient has 1 liter of water. Second, milk, banana and groundnut shake at 8 o'clock. Shastrakars have mentioned Guru Snigdha Pan is the Nidan. So isn't it Guru Snigdha heavy drink early in the morning for breakfast? One of the very major reason for increasing the patches. Lunch dosa uttapam, and patient wanted fresh food or the hot food. So he used to heat it in the microwave in the office. Dinner by 9:50, before sleeping 250 ml of water, non-veg. Then veg days, dosa uttapam or fermented food. Non-veg days, 7 days, 3 days, he used to have seafood or meat. Stools were loose, bad odor. Use of laptop in the toilet. Laptop in toilet. He used to check mails. Sweat stains after waiting, bad odor. Sweat very less. Dreams very less, but usually of snacks. You can see 14-7 patient approach like this. 37. After 15 days of treatment, patches completely gone. Completely. One meditation was done during this. See, first patches after that. So these are the miraculous results. After that, I did Bowman direction. Now completely patches has gone. Just the discoloration is there. The treatment for discoloration is still on. Ayurvedic Vardhini Webinar, the mainstay of treatment, where you can give in all types of kushta. It has Nimba, Bhavana, Mandalam Sevita, Sesha, Hanti, Kushtanya, Sheshata. All types of kushta, all types of jvara. It is Pachani, Deepani, Rudya, Medoro, Med, Kled, Har, Malashuddhikar, therefore indicated in all types of Kushta. Panchatikta Ghrut Gugu. Where to introduce? You can see in this line. Sandhi Asti Majjagat. Sandhi Asti Majjagat means psoriatic arthritis. It has gone into the Asti Thandi Majjagat. There you can prescribe Panchatikta Ghrut Gugur, which has been mentioned in Bhaishya Ratnavali Kushtarogatika. Psoriatic means nail psoriasis. If you have seen there also, as Nakha is Ati Dhatu Mala, there also you can give. In psoriatic arthritis, you can also give uh, Panchatikta Ghrut Basti. Of course, after initial sugar. Kanchanar Gugur, Kanchanar Tvachograyam. Here you can see Granthina Vranasya Gulmasya Kushthanica Bhagandaram. It is Rakta Prasadankar, Medoha, Raktagat, Doshapachan. So therefore, Kanchanar Gugur works very well in psoriasis cases. So let us go back to which diet was prescribed for psoriasis patients. Very important treatment of all living other things. No salt diet for initial 7 days. This gives best result. Best result. Mostly my patient in my area are Kokani, Malwani, and a few south. So kanji peda they are very used to. I give them 10 gram of roasted rice, added to 400 ml of water, boil it to 200 ml, add ghee and have it for breakfast. Only this will be your breakfast for first 7 days. If patient feel low energy, then ghee, rock sugar, bhakri is also given for lunch. After that, add upma, thalipid, non-fermented dosa or chila. Strict no to green leafy vegetables, bakery, brinjal, fermented Chinese, chaat, packed items, sour items, stale food, boiled water throughout the day. Lunch, pitakal, considering that 10 a.m. to 1 p.m. Either of the millet bhakri with ghee, one bowl of moong dal, carrot, beet steam. If it is seasonal, then only one fruit vegetable like curd, dudi, kobi, flower, everything like that. Steamed rice, but made in pot, not a cooker. Cooker rice causes clay, and therefore, as I don't want clay, so I tell you to prepare in the traditional manner in pot. Non-veg food not allowed in the initial days. Only plain soup for energy giving is permitted. Gulkan, Moravada, jalebi is permitted, provided jalebi is made in ghee and at home. Moravada and Gulkan, it is I give it from my own clinic only. Munakka, Anjir, Khajur, pomegranate is advisable in middle if patient feels hungry. I hope you all had dinner. So this all looks very tasty. Which Panchakarma procedure to do first? Depending on those Rutu symptoms, we will decide. Patient has bloating, go for Yog Bastikram. Patient has acidity, severe itching, I'll be going for Boman. Deepen Pachan करके ही करना है. First we need to go at Deepen Pachan. And then if Daha, Pushul, Pus, any discharge, Virechan and Sirave. Stress is the leading factor. Go with the Shirodhara or Takradhara and Nidrajana Nasya. Rakta Dushti Hetu is there. Sirave, Leech, Virechan. Nasya for daily use. Nidrajana Nasya, very good. You can prepare 100 ml ghee, 1 gram of kesar, 4 spoon of rock sugar, mix it well, kharal kar lo and add it to ghee. Very good for sleeping. Is Srotovradaत्मक संप्राप्ति is there, Vishwachurna Pradhamanasya. I will go quick now. Line of treatment. The basic kara, Laghu Manjishtadi kara, empty stomach with Mahatikta Ghritam, early in the morning, empty stomach. Kaishur Gugur, before food. Psoriasis formula. See, you can see all the Pittagna Dravya. Kambuda, 20 tablets. You can note it down. Shweta Chandan, Hamsapadari, Ushir, Ananta, Trivanga Vasmu. It has major role in Kushta Rog, Ledagna. Dhatu Posham, and give this formula at 10 a.m. and 2 p.m. with Mahatikta Glutam. Very good. Pitta Kal mein dena. Arogyavardhini Viti, Triphala Churna, Arogya Churna for Rechan. If severe constipation, heart stool, Sunti Siddha Eranda Teva. Panchatikta Grut Gugul. These are the main oils. Sora Siddha oil of SKM, SKM Sora Siddha cream, SKM Sora Siddha soap. Daily use. Arabadati Kashayam also I add, or Manjishari Kashayam for Rakta Shuddhi, or Arabadati Kashayam for Rachel. If patient has acidity and low energy levels, I add Avipattikar Shurna. If Nasya disturbs sleep, Nidra Janan Nasya. Sora Siddha oil content, you can go through it. It is also available on SKM site. Sora Siddha soap, Puttajana Bakushi, Sora Siddha cream, Puttash Karanja Khadira. Treatment to do for instant relief. Patient comes to you, wants instant relief, does not want to wait for the next 7 days. Otherwise, he'll end up with taking steroids or something like that. So, Siravet for complete body itching. But Shastrakar has told Siravet should be done, but Prana Rakshan is very important. So, Siravet, because burn of the patient is low. So, Siravet followed by some amount of Grifan is very good. Otherwise, Gripan, Siraved, and again Gripan. Least therapy for local patches, Siraved for complete body itching. More stress, Tapnadara, Riteladigan, Mustadi, Amalkileka. Additional medicine, if patient's hemoglobin is low, add Taperido. Ketanashan of copper, Raktadhatu Poshan, Panchatikta Group 2 group for psoriatic arthritis if nails are involved, Rakta Pratasan and Vatashaman, Karyo, Panchatikta Group 2 group. Adman bloating, you can add of normal medications. I add Vaidya Patankar Kada or Abhyarisht or Dashamula Rishta. This is very good. Basic investigations, vitamin D, vitamin B12, because nowadays it is very low in patient. CBC. So this is what is mentioned in the text. Psoriasis or any type of kushta is not possible without three doshas and four dusha. That is swa, mansa, shonit, lasika. Na ekam dosham kinchitam kushtam. One dosh cannot lead to kushta. So when all these are included, then only it will be the taratam bhav can be there. Either a little bit more of kapha lakshana may be more, but three doshas are always included. Nidan, Virodha Anna Panani, curd at night, taking excessive sweet at night, black gram, sour substances, more achar bahut khate hain. Eating curd, nowadays fad is there. Eating curd, topping it with any of the sweet. Drava Snigdha Guruni. We can see shakes early in the morning, heavy to digest, budget. Here, suppression of natural urges, excessive physical activity after meal. Patients are having this. They are having some pre-energy before going to gym and then exercise. शीत उष्ण क्रम सेवन बाहर से आते हैं. They come from outside and wash legs, take bath with cold water, drink refrigerated water. Basic, very day-to-day life causes. Excess food, uncooked food, intake of food before previous meal is digested, improper panchakarma therapies, excessive intake of freshly harvested grains, intake of mash, more, jaggery, til, mulak, sexual act with while suffering from indigestion, sleeping during the daytime, रात भर जागो and दिन में सो जाओ. This thing, insult to the priest or sinful act, this is also mentioned. These are the Vatas Kushta Lakshan, Roksha, dryness, Parushyam, Shava Varna, Kharabhav. These are Pittaj Kushta, Tushila psoriasis. This can be considered Daha Raga, Paristhav, Papa, Vitra Gandha, Kafach Kushta, Shvaitya, Chaitya, Kandu, Stairya. These are all Lakshana of Kapha. Eka Kushta. Asvedanam is the no Sved, Mahavastu. We have seen in the first case. Matsya Shakalopam. just like resemble the scales of fish. You can see in the image. It is Vat Kapha dosha prominent. This is typically psoriasis, what we can see. Vipadika Lakshana. We have seen the case now only. Panipada sputanum, cracks in palms and soul. Trivra Vedanam, painful. Chikitsa Kram, as we have done. But what Granthakar has mentioned, we also look into that. Pataptareshu Sarpi, Ghi, Neshmottareshu Vamana, Pitta, Mokshan and Rakta. से विरेचना प्रच्छान कर्म फॉर अल्प कुष्ठ एंड महति कुष्ठ पूरे शरीर में है तो सिरावेद करना है स्नेहपान तभी करना है जब कोष्ठ की शुद्धि होती है when your कोष्ठ is clear then only स्नेहपान should be done बहु दोषस्य संशुद्ध you should do संशोधन शोधन but on keeping in mind the prana of the patient common yoga these all are drugs which are mentioned in the text limba patol limba madhuk madanfal ayus madanfal limba honey madhuk virechan drug trivruta danti triphala are mentioned Astapan Basti drugs, Basti, when you have to give a Nirva Basti, these drugs you can add, it has very good results. So this was it. I went through all the cases, the text, what the Grantaka has mentioned, and this is it. If you have any doubt, like all are doctors, feel like adding more to it.
Hey, thank you so much, Dr. Anuja. This was a very insightful and enriching presentation today. Your expertise and knowledge has helped all of us with a very deeper understanding on this particular topic on psoriasis and its line of Ayurveda treatment. And it can be very helpful to all the doctors present here. So before we conclude, I would like to open this floor for any questions. Please feel free to raise your hand or type your question in the chat box, and Dr. Anuja will help address them. The Q&A shall be hosted and managed by Dr. Snehil Makwana.
Thank you, Anand. If anyone has any question, doubts, please put in the chat box. Dr. Anuja, it was an amazing session, eye opener for new practitioners. The craze presentation was amazing. The result was instantaneous, and the line of treatment explained was perfect according to Grantha even. It was a very good session. If anyone has any doubt, please raise your hand or you can put it in the chat box. So, Dr. Anuja, do you use Nasyas also for stress management? And which Nasya?
Basically, whenever a patient comes to my clinic, first I do Shodhan Nasya, the bit Suddhi, Vishnu, and for stress management at home, Dhuman Nasya, which is Nidrajana Nasya, as I mentioned, and that Nidrajana Nasya contains Kesar, 1 gram, 20 gram of raw sugar mixed with, and then add to the ghee, 100 ml ghee. Just make that chocolate ball out of that, heat it then on, and that nasya can be packed and given to the patient. It has very miraculous result in sleep or stress management.
Okay. One of the attendee, Dr. Anju, has asked, Takradhara in winters, won't it cause any adverse effect?
I am unable to read.
Okay, I will repeat. Takradhara in winters, won't it cause any adverse effect if it is
Yeah,
used in winter season?
just go with the atmosphere also, not just simply giving. Of course, we need to consider the atmospheric changes. Usually, if I want to give it in winters, I'll be asking the patient to come at 12 o'clock in the afternoon. go with a pack, complete scarf and all at home, and dry your hairs immediately after going home. So this is what I do. If it is extreme cold, then maybe I'll be waiting. Extreme cold or patient already has some cold like symptoms, then I'll be waiting. Will not go immediately with the Takragras.
Okay. Next question is again from Dr. Hanju. Ghee nasya do you give before bedtime? And are glass bottles used for ghee storage for nasya?
I'm unable to hear. There is breaking. Can you
Okay.
repeat?
Okay. My voice is clear now.
Yes, Dr. Snail. Yeah, can you please repeat the question?
Yes. Ghee nasya, do you give ghee nasya before bedtime?
Yes, yes. Before bedtime.
Okay. And are the glass bottles used for ghee storage for the nasya? Do you use glass bottles to store ghee?
No, I don't use glass bottles. Means
Any
frankly
part
speaking, I don't use.
Okay. Any particular thing you want to ask Dr. Anju? You can unmute yourself and you can ask. Okay.
I have allowed mic for Dr. Anju. Dr. Anju, you can please go ahead.
Hello.
Yeah.
Yes.
Yes, Dr. Anju,
Hi,
we can hear
doctor.
you.
Yes, yes.
I
Thank you for the wonderful session, doctor. No, these are the normal general queries, which normally when we give patient ghee in the, plastic bottles, patients are like, doctor, no, you should use glass bottles because, the ghee and, when you have to melt the ghee to put the drops in the nostrils, then if you have to put the bottle or your plastic bottle again in warm water and, the problems with the plastic, which nowadays people are so
yes,
aware of all
yes,
these
yes,
things.
yes.
That was my question. And basically, to relax the mind, whether the ghee nasya was used at bedtime. This was my main question about it.
I used it at bedtime only. The question regarding that plastic bottle, I never faced the issue with that. So, the better thing is always with the glass bottle. Yes, that is the best thing. But to make it financially feasible for patients, I added in a plastic bottle. And if it get free, so I tell them to keep it for just 1 minute in a bowl of hot water so that it will get melted and you can use.
Yes, exactly. So, yes, but I think sometimes,
So financial feasibility is the major factor. If your patient have
yeah,
no problem, then you can add it
can
in
go
glass
for it.
bottle. That is the best thing.
Yeah. Thank you so much, doctor. Thanks.
So, Dr. Anuja, we have another question from Dr.
Yes.
Shrikant. A 10 years old girl child having scalp psoriasis but doesn't have any symptoms like itching or burning except scaling. What should be the line of treatment? Please suggest.
Line of treatment. If see initial days, since a 10-year-old will not be going, will not get initially ready with the woman viration thing. But you have to make her ready for that also. I have done a woman of like 5-year-old patient, 10-year-old patient. So through the process, you can do her counseling of her parents and her. Then definitely woman and these things are very important to prevent the recurrence. But initial days, you can go with the Takradhara. Patient will also enjoy. Takra वेट क्लीनिंग आहे लघुमंजरी काढा आरोग्यवर्धिनी कैशोर बुबू this all you can add. Definitely this will help. And if our stomach is not clear, go with some kind of ration. And Mahatikta Drutpan is very important. One thing I missed that I'll be telling you. For next 2 years, I give Mahatikta Drutpan as a rasayana to patient early in the morning. Even when patient has no complaints, no itching, I'll be giving Mahatikta Drutpan as a rasayana treatment early in the morning, empty stomach, to prevent the recurrence. I hope, sir,
Okay.
I have answered your question.
I'll just unmute Dr. Shrikant. Dr. Shrikant, please, you can unmute yourself, sir.
Yes, ma'am. Thank you very much for the guidance. Right now, she is having a little bit of worms also, and she is not aware of her actual appetite.
Sir, if she is having worms, you can go for Krumigna Basti also, and
Hmm.
of Churunodak and Karanja Tel. That
Okay.
can also be one of the cause for clay leather. So you can go with that. Reduce her chocolates, bakery items, and
So,
like Nidan Sevana and all the doodh, white things which are krumi priya that you can do. And main thing is krumi kuthar you can add,
sure, sure.
and Vidangarist also you can add in such cases, because krumi
Yeah,
is one
sure.
of the major factor in children, even when we relate it to psoriasis, as it causes clade.
Yes, that may be cause, and actually, she is very fond of fishes, fish food. That may be the one of the
Yeah,
major
you
cause.
need to stop with her. You need to
Exactly.
stop with that because that is guru na Abhishandi.
Yes, yes.
Yes, sir. Yes.
We'll do that. Thank you.
Okay, sir.
Yeah, Dr. Snail, are you there?
Yes, yes, Anand.
Yeah, yeah.
No
Please,
more
yeah, you
questions
can.
I see in the chat box. Most of the questions are has been answered. So shall we close the session?
Yes, Dr. Snail. So I'll take it from here. We thanks a lot to everyone here in this webinar for your active participation and engaging questions. We hope you all found this session very valuable and informative. And once again, a big thanks to Dr. Anuja Salwatkar for sharing her expertise with us today. And thanks to all the participants for joining us. We look forward to seeing you all in our next Gyaan Vardhini session, which is scheduled on 24th of February to be conducted by Dr. Ahmed Savani. The topic is Ayur emergency, scope of Ayurveda in acute emergency conditions in cancer and severe critical illness. So I'll be sharing a few links in the chat box as well, and we'll be closing the session now. Again, thanks everybody, and wish you all have a wonderful evening. Thank you. Closing
Thank
the
you,
session
Dr.
now.
Bala sir, Anand sir, Snail sir, for guiding and providing this platform for beginner doctors like me.
A big thanks to you, Dr. Anuja, again. Yeah. Wish you have a great day. Wish all a great day ahead. Yeah. Thanks. Bye.